Good morning, ladies and gentlemen. I would like to present my paper. The paper title, The Effects Between Service Quality, Trust and Leadership Toward Inpatient Satisfaction in Community Medical Center, Lawang, Municipal, South Sumatra, Indonesia. This is the paper, the research teams. The first author is Bambang Sugiyono Agus Purwono. The co-author is Muhammad Jasin, Imanuel Teguh Harisantoso, Muhammad Fahim Tharaba, and Dr. Ali Nasith. The first, I would like to thanks to organizing committee of the third International Conference on Management, Education and Emerging Technology, ICMIT 2022. This international conference will be held in Jakarta at 22nd of October 2022. The themes of this international conference is empowering recent trends in education, science and technology. This conference organized by Core Research Foundation India, and thank you to Mr. Ankit Raj, Mrs. Priyanka, and Priya Darsani, also all the organizing committee and steering committee. The outline of my research title is research background, literature study, research method, result and discussion, conclusion, and references. The introduction of my research paper is WHO, World Health Organization, defined health as a condition of complete physical, mental, and social prosperity, and not simply the shortfall of illness or ailment. If someone becomes sick, the patient will try to look for the health facility near their place. Indonesia has two health facilities. There are private and state health facilities. Two state facilities are hospital. They are divided by Class E, Class B, and Class C, and Community Medical Center or Puskesmas, Pusat Kesehatan Masyarakat, according to the rule of Minister of Health, number 43, the year 2018 and 19. The research background is community medical center is a health service facility or a well-being administration office that convey out the local area medical services and individual medical services states one while leading promotive and preventive medical services in their functioning region. The second, CMC, Community Medical Center, must give medical health services, and yet CMC must always try to improve their service quality, patient trust, and also improve the patients and community's satisfaction. Number three, problems occur when people need services at CMC, like the confusing system regulation and complicated bureaucracy. CMC at Pendopo Lawang Municipal, South Sumatra, Indonesia is one of the CMC in Indonesia, and it's also one that can give the optimal service to the people in the surroundings with good responsibility and high perfectionism in order to get high patient satisfaction score that can be recorded as data for inpatients in the CMC. We can see on table number 1. Table number 1, data inpatient satisfaction in Lawang Community Medical Center, year 27 till 2018. There are two types of inpatient. Number 1 is satisfied and dissatisfied of the services. This is the patient the patient that have received satisfied, and this is for the patient that received dissatisfied. The total in 2017 is 215. This is the data in 2018 and data 2019. The objective of this research is to analyze the effect between service quality, trust, and leadership toward the inpatient satisfaction at CMC Community Medical Center, Lawang Municipal, South Sumatra, Indonesia. The literature study, the definition of service quality, is a multidimensional research instrument or variable designed to capture consumer expectation and perception of a service quality along with the 5 dimensions that are believed to represent service quality. Service quality is built on expectancy. This confirmation paradigm, which in simple terms mean that service quality is understood as extent to which consumer pre-consumption expectation of quality are confirmed or disconfirmed by their actual perception or the service experience. This is the definition of service quality. Table number 3 shows that service quality is multi-dimensional research instrument or variable. I have told to you. Definition of trust. Stephen P. Robbins stated that 5 aspects that make up the idea of trust. Trust is characterized as a faith and the honesty, character, and capacity of a leader. Table number 4 shows that 5 attributes of trust are integrity, competency, consistency, loyalty, and openness. The definition of leadership is the process influence a group of people in active goal. This is the definition of leadership. Definition of satisfaction. Philip E. Coulter stated that satisfaction is a person feeling a pleasure or disappointed resulting from comparing a product's perceived performance or outcome in relation to his or her expectation. This is the previous research. There are 4 researchers about this topic. This is the 5 dimensions of service quality: responsiveness, tangible, empathy, assurance, and reliability. This is the 5 dimensions of trust: integrity, competence, consistency, and loyalty, and openness. The research methods discuss about Likert scale, mathematical model, and conceptual framework. Using mathematical model and multiple regression analysis. This is the Likert scale, disagree strongly, till agree strongly. This is the mathematical model, multiple regression analysis. This is the dependent variable. This is the independent variable. There are 3 independent variables. The null hypothesis is rejected. It means that a relationship between service quality, trust, leadership toward impatient satisfaction. Place and when the research was carried out. The research was conducted at Jalan Nurdin Panji, Puskesmas Pendopo, Kabupaten 4 Lawang, Sumatra. That data were collected from May till July 2022. This is the conceptual frameworks. The dependent variable is service quality. There are 5 attributes. Trust, also 5 attributes, and leadership, there are 4 attributes. And the dependent variable is inpatient satisfaction. Research and discussion. The description. The result was obtained from the primary and simulated data computation obtained from data distribution and questionnaire to the subject of the research who are the inpatient respondent and numbering to 40 patients. The multiple regression analysis, there are regression coefficients and t-test and significant. This is the mathematical model. Y is 4.196 minus 0.049x1 plus 0.093x2 plus 0.061x3, or the dependent variable y is impatient satisfaction as 4.196 minus 0.049 service quality plus 0.093 trust plus 0.061 leadership. The equation number 2 and 3 show that the highest contribution to impatient satisfaction is trust. This is trust because the contribution is the highest one. Trust variable regression coefficient is 0.093. The second is leadership variable. The regression coefficient is 0.061. And the third is service quality variable with regression coefficient minus 0.049. And this is the negative contribution. The conclusion of this paper is the mean value of the variable of service quality, trust, service leadership, and inpatient satisfaction score is above 3. It means neutral or approach to better. A community medical center Lawang, Municipal South Sumatra, Indonesia. The biggest contribution to inpatient satisfaction is trust variable. The second is leadership variable, and the third is service quality variable. But the service quality is negative contribution. The references. This is the biography or biodata of the first author. Thank you very much for your attention.